everyone. I want to welcome you to the second live cast in the Zayo series. Today, we're going to talk about healthcare. My name is Will Townsend. I'm the Vice President and Principal Analyst for More Insights and Strategy. I manage the networking and security practices. And let me just set a little bit of context. And I actually have some relevant experience in healthcare before becoming an analyst. So healthcare is a challenging environment. Certainly when you look at connectivity, the age of hospitals and even new construction with all the metal that has to be contended with creates almost a Faraday cage-like challenge for propagation. There are also challenges around making technology unobtrusive within the electronic medical recording process as well. And so that just, again, sets a little bit of context for the conversation. Ed joins me today from Zayo. And Ed, before we get started, can you introduce yourself and explain what you do at Zayo?
Sure. So my background's in kind of network architecture, service design, that evolved into a bit of a product role. And over the years, I've moved myself into sort of the product and edge space. As part of the team that was heavily involved in looking and evaluating and bringing QoS into the Zayo fold to further enrich our edge and SD-WAN services, one of the best in class. I'm now part of Zayo. Now I have product ownership of our edge product portfolio, which basically includes SD-WAN and managed edge services, which are all the services that relate to the SD-WAN portfolio.
Great. Well, thanks, Ed. I'm looking forward to the conversation. So let's get started. I shared some of my insights, related to some of the challenges that I've experienced personally. But from your perspective, what are some of the emerging trends in healthcare and what should providers be considering?
Yeah, so healthcare is kind of an interesting one. And coming through the pandemic, we've seen a lot of changes in the space, and there's been a lot of challenges to how people operate and really kind of forced the models to change a lot, which brings an interesting conversation around technology. There's a lot of focus on improving patient outcomes through technology and systems. So better information flows obviously translates into better informed diagnostics, accuracy, and ultimately that drives better patient outcomes. Again, workflow is now we've moved from paper into systems, but those systems now are become critical. Workflow stops. Hospitals literally close the door to new patients. We had one of our customer a few years ago that had a DDoS on their main internet service, and the impact was so large that they literally closed their doors and stopped accepting patients coming in. Whereas, 10 years earlier, that would have been just kind of a non-event. The Wi-Fi is down, we can't get online, but business as usual. So the technology focus on systems really drives a dependence on technology and connectivity to do the day-to-day operations. Another thing too we've seen is moving away from major care centers to smaller locations. It's no longer that you have to go travel a long distance to find a specialist to sit in the high-end hospital. Taking all those care functions and splitting them out to provide better patient access, better outcomes, while still maintaining connectivity to the best-in-class care providers has changed the model. These small locations may open up and close on a moment's notice as demand changes or as a pandemic hits and so on. But even though they're smaller locations, the reliable, consistent connectivity need is just becoming more and more prominent. Regardless of the location side, that small location has the same requirements to operate as that major hospital, but we can't justify traverse fiber access into those. So you have a lot of interesting challenges in how to relate and get into the market with a scalable solution and technology. Those small locations still rely on the same patient flow systems, the same record systems. Staff enablement becomes an interesting problem. You can't bring all the staff into a classroom now to do training in the hospital. You need to figure out how do you move that experience out to the edge where the clinic resides to work with them on that. So it's kind of an interesting scenario. The ability to fail back to paper records is not something we consider anymore. It's a last ditch effort in a true disaster only. Nowadays, if there's impacted systems, we stop accepting patients and we direct them elsewhere. So it really changes things. And then if you look at ultra realistic patient simulators, we're not just doing a CPR dummy. The whole thing has got telemetry, it's all integrated. It may work with cloud applications to fully emulate a better training experiences. But that whole environment now relies on better and predictable latency, jitter, packet loss, all these things that we care about in networks suddenly become absolutely critical. And then as we look at all this data, data-driven decisions are becoming critical to optimize how we operate. Those data-driven decisions mean lots of data collection, lots of data sharing, doing it securely, training and using AI and machine operations to improve diagnostics. The further you go into that space, the more important it becomes to understand those data sets and where they come from. Healthcare is extremely complex domain that's got a lot of involved and interdependent disciplines with a huge domains of measurable data points. Those ultimately all come together to directly influence patient outcomes. Gathering that data accurately and securely becomes a huge challenge when it's generated physically all over the place. It could be at a patient's house, could be in a hospital, it could be an outpatient clinic. All those things need to come together to ensure better outcomes. So understanding like where we're going in this space, the questions that get asked is, where do we need to focus on these things? And the key question I think people need to start asking themselves is kind of the blow it up model. What happens if things go wrong? What systems are critical? What can I operate without? If you mentally perform a bit of a screen test on key platforms, if you were to cut them off, sever the fiber, what would become critical in 1 minute, 1 hour, and 1 day for an outage? That will help you understand what really is critical. And it sometimes reframes the picture. We often focus on the really fancy things. We forget about the things that are not as important. So is the ability to pull patient records from the cloud the most important thing to provide care? Is insurance and patient billing a key criteria before you can take someone in the door? Or is that only a matter that you worry about before they leave? We like to think about things like robotic surgeries and all these fancy use cases, but realistically, it's the boring things that will shut the hospital down and drive the business to a halt that you need to configure those first. We've seen examples elsewhere in industry recently where network outages were exasperated because they couldn't get in the building. They couldn't get in the building because the door control system relied on that network to authenticate and failed secure. So it could be a tiny little system that becomes absolutely critical, and understanding that becomes really important to look at.
Yeah, connectivity is critical, like you mentioned. And when we think about, patient recording, but if you can't walk through the door, that's a deal breaker, obviously. And, my wife's in the medical field as well. She's a retina scribe. And the EMR system they use an example, it's a SaaS solution. So when connectivity goes down, they can't input any sort of patient data, and that grinds their clinic to a halt. So you touched on security. That's obviously very critical, especially in a healthcare environment when you think about HIPAA compliance, but there are a lot of other things that factor there. But kind of considering security and, sort of the application set that's required and connectivity, what should healthcare providers factor into their strategic planning?
So I think there's probably about 5 things we need to consider. The first one, to my point I was just talking about, is you need to truly understand your applications. A lot of customers that come to us that want to engage and kind of evolve their networks are fairly confident in what they're using, but the reality is very different when we start getting in the weeds. And one of the best ways to do, like I was talking about the screen test, is really to look at an emergency response plan. What are the secondary fallouts of an outage? It's not the things we think about, it's always the other things. Spend that time to understand the business and key systems you rely on. Don't just focus on the shiny things, the new platforms, the one that everyone's put the funding into. Talk to the teams you don't normally associate with. Spend some time with the building infrastructure group and understand where they're going with IoT, for example, what systems they rely on to operate. If you want to be bold and you want to get right down to the answers, tell them you're going to block all their network access and see what networks they raise up as a quick concern and issue. Game out with them. What happens if the building loses connectivity for 24 hours? You may get some interesting insights you weren't thinking about. You might discover, for example, the HVAC system in a hospital environment has safety validation procedures. Maybe those rely on something in the cloud to validate, and it shuts down in protection mode if that stops working. You could lose a critical system because you didn't plan for it, and it has to call home once a day, but that call home is absolutely critical. So you have to keep an eye out for those critical applications that no one thinks about, but everyone relies on and would be in trouble with that. Another thing too is we get into more IoT and portable technology. Does a patient care device need to talk to the vendor or to cloud services to operate? Does it need to check its license is valid? Does it stop working if it loses connectivity? How do things fail? Understanding how things fail will help you understand what matters really and allow you to prioritize those things. Do your imaging devices rely on local storage, or are you using the cloud for everything now? Does your building Wi-Fi rely on a cloud controller? And if that controller goes offline, does the Wi-Fi turn off? Does that mean that your in-building devices can't talk anymore when you lose connectivity? Patient care could be dependent on very basic connectivity that could fail on you if you don't plan for it. The second thing to think about is the whole evolution of telehealth and remote patient monitoring. It's no longer going into the hospital to get your care. Your care is part of your life and where you are as well. providing key infrastructure to support remote healthcare direct to end users or at remote locations from a campus health center. In some cases, this could be video conferencing, or it could just be patient info exchange. Those are for two very different use cases, two very different application profiles, two very different bandwidth demands. A radiologist that provides after-hour diagnostics from their house has a very different traffic profile than a telehealth video consulting doctor's office. And both of those are very different than a mobile inoculation clinic. All of those may need access to the same systems, but different profiles. So now you've looked at the applications, you looked at where you use them, how you use them. You need to look at how do you minimize the attack surface, the security posture of these things. We're just putting all this data out everywhere. How do you protect against that? So zero trust starts to become a really interesting conversation. And zero trust is based on the idea of how do you minimize the risk exposure on a per user level with some kind of security service edge, different forms and factors that takes. The idea is to start denying everything as the default status, and then only allow what you absolutely need to complete your job for that user, for their work purpose, for their work time. This helps mitigate the risk exposure for when a breach does occur. It's mitigated and contained in that space. And as you go down that security service edge road, you start getting into the SASE space, which is SD-WAN plus that combined together to look at how do you build a cohesive network that does all those things together. By integrating the two together, you get an experience that's a cohesive solve for users, regardless of where they are and how they're operating, whether they're coming from home, they're coming in the office. You're treating them with the same status, the same connectivity, the same positioning, and it's a consistent experience to them. But you're not dealing with a scenario where people in building are very secure and people that are working from home are very insecure. You're taking the same security posture. You're enabling them to operate, but not taking the risk either. And the fifth thing is to really look long and hard at the whole IoT and device telemetry space. As devices are connected for remote surveillance, data analytics across the entire health network, across all the different disciplines. Similar to the resiliency question, look at portability across the broader health domain. Are devices going to change buildings? How does that work? How do they communicate? What does that look like? Devices move around, data moves around. How do you secure that? How do you control it? Answering those questions will help you kind of make the next steps in that space.
Those are great insights. I'll just add, from a zero trust perspective, zero trust network access, ZTNA, was originally cast as a remote access solution, but I've written about this on Forbes as well. It's really becoming adopted universally. And the power of zero trust, from my perspective, is in its ability to authenticate a user to an application and not flatly to a network, to prevent that, that threat of lateral movement across a network. And so, we're seeing a lot of discussion around zero trust, but at the end of the day, from my perspective, that's its true superpower. But as we close our conversation, I'm curious, Ed, can you provide some specific examples of how Zayo has helped healthcare organizations with their connectivity needs and all of the other things that we've been talking about today?
Yeah, so I'll go back first of all to that DDoS example. That was for me one of my first kind of experiences understanding the direct human impact of network events. One of our customers that was just an internet customer had a major DDoS attack. Thankfully, they called us up. We were able to do a rapid response, get them back online within an hour and a half or so. They were able to reopen their doors in that period of time because we were able to respond and mitigate that attack. But to me, that kind of demonstrated to me personally that what we do directly impacts people. It's not kind of this disconnected things where if the internet goes down, the network goes down, things continue to operate just inconvenient. That directly impacted users that showed up and the doors were physically closed to them. As we get into the SD-WAN space, though, we have some really interesting examples in dentistry, for example. You've got organizations that have many, many locations to serve regions, but they're all moving all their patient care to systems like Epic and so on, where they're seeing their networks expand and grow, but they're not in one building. They're now spread out everywhere to provide local care, but they're consolidating in the background to get better efficiencies and operate at scale better. When they do that, they're now relying on those electronic patient care systems for other data and for operations, which makes it harder to accept an outage or an impact. Everything stops, everything shuts down. You don't know who's who, you don't know what you're working on. All the work stops when that goes down. It's no longer an acceptable kind of best effort. Yeah, the internet's down, the Wi-Fi's down, but things continue. That's no longer the case. Along that trend, the migration away to smaller care centers, we still require that 100% uptime. And the reality is you can't afford, Traverse fiber that you would afford a major hospital campus. So the question becomes, how do you make a business decision and a design decision to get 100% application uptime, but operate on cheap and cheerful infrastructure? And we're seeing a lot of customers moving very quickly to SD-WAN as the key solution there. We'll be able to help transform a lot of businesses, lower that operational cost of private connectivity, but actually improve the resilience of the solution by bringing other carriers, other technology types in to ensure that there's at least one solution that always works. We've had some really interesting challenges we've helped solve with remote support for diagnostics. That radiologist from home example was a customer we dealt with that was really interesting, where one radiologist was supporting a whole slew of different clinics and customers, but they need to operate from home as well as from their office. Mm-hmm. That's an interesting technical challenge. It seems very simple for people that work from home to understand that, but when you're dealing with health data, you're dealing with security, that is a bit of a different problem set. And be able to override over top of the existing connectivity was kind of key, and still maintain that secure and flexible solution was part of that. And as we see staff moving to more diverse locations, the training problem becomes more complicated. And other lifecycle activities that are really simple to support in the office is now interesting and challenging, but you have to emulate that. And you actually have to do it better than you can do it personally, because you have to somehow maintain that one-on-one experience remotely. So we're working with some of those mini clinics to become extensions to major hospitals, but still allowed that 1 or 2 person clinic to operate like part of the hospital, give them resiliency, but allow them to, as they stand up the new location, train their staff remotely with all the capabilities. And then once they're trained, open the doors and operate with reliability, I guess. Right. As part of that, there's also the whole thing of how do we segregate applications? How do we segregate traffic and make sure that we have segmentation, all these things to ensure that the local compliance initiatives are met? And how do we focus on a good security posture that meets the performance requirements? We can't stop things for security. We have to enable things for security and find a posture that finds that balance. One of the big things that drew us to QoS Networks, and that QoS has really built out and now is part of Zayo, is a focus on building network observability capabilities rather than just network monitoring. This has moved us from being just able to tell the customer it's broken or not, and that's something they're probably well aware of by the time we talk to them, instead to give insights into network health instead. If you think about this in a healthcare scenario, knowing a person is dead or alive is useful, but is really not the way to approach healthcare.
Right.
You want to understand health. You understand and be able to proactively mitigate unhealthy issues and see issues before they become chronic or tragic. Yeah. Is really important. Good patient outcomes are driven by finding those little issues before they become a big issue. And really the same thing applies to networks too. We've just accepted historically that network outages occur. We're now moving to a place where network outages are no longer acceptable. We need to understand network health long before it impacts that. So this, for us, was a real pivot to focus on applications, as they're really the day-to-day things that determine customer satisfaction. A network outage may or may not impact an application, and that might be okay because the solution can work around that. But an impact to application will always impact the user, and that's ultimately what matters to customer experience, matters to patient outcome in healthcare. So that's something to keep in mind as we move forward, that network health becomes much more important than just network monitoring, which is kind of the old-fashioned posture.
Yeah, I mean, network health can help keep the health of a healthcare institution in check, right? I'm glad you touched on observability, because there's a lot of attention around observability versus just purely visibility. And it's that notion of understanding what is connected to your network. And then to your point, not all issues will affect outages and that sort of thing, but certainly in a healthcare environment, you touched on IoT as well. A lot of those devices are headless. They're difficult to monitor. They're difficult to manage. And so I think, with what Zayo brings with its, capability around observability, I believe is huge for healthcare. But as we wrap things up, I have a follow-up question for you, Ed, and it's if you could give 2 or 3 tips to people that they're likely in healthcare not starting the digital journey because there are a lot of mandates right around electronic, medical recording. But could you provide some tips around how healthcare institutions could optimize their connectivity needs?
Yeah, I think it goes back again to the thought on applications. You need to understand what your problem is first. A lot of people try and solve the problem, jump right to a solution without actually understanding what they're trying to solve. Understanding what is absolutely critical is the place to start, and then sizing that accordingly. having network technology like SD-WAN allows you to control and mitigate issues by deprioritizing. If you have an application that requires at most 5 megs to operate your remote healthcare center, that's your design criteria. You may have a 100 meg connection, but if things go bad, being able to deprioritize those less essential applications and ensure priority for that 5 megs of traffic, that becomes really interesting, and it changes how you approach your design. Is how do we protect that 5 megs at all cost? And you start looking at resiliency, multiple connections, whatever those things are to mitigate that. I think that kind of approach first really does help right size and allow you to optimize. We tend to throw a lot of, if you're a telecom person, everything's a telecom problem, so you throw bandwidth at it. If you know that old adage, if you're for a hammer, everything's a nail. We tend to take what we know and just throw it at it. Understanding the problem first, I think, is the biggest advantage to have. Understanding why you need a network, and then what happens when you don't have the network. What does that look like? And that's going to very quickly dictate the amount of investment you're ready to make. If your hospital is going to close, your clinic closes, and you stop processing patients the moment it goes offline, your willingness to spend and invest in resiliency is going to go way up. And if it doesn't, then you don't need to make that same investment. You can make a much lower investment. Having that business outcomes when things hit the fan is going to give you that context to help you design right and have the right engagement. And then right size to understand the things you don't need. You can deprioritize that public Wi-Fi and then Netflix for your patients when things go wrong. That's okay. But other things are not okay. And be able to make that decision really is important to have. At the end of the day, network connectivity is no longer just a nice to have. It's essential to operate in pretty much every scenario. And the biggest challenges we're seeing now is those smaller centers where they're starting to branch out from the major campuses, and they're going and renting a room in a house in a university campus, for example, to provide healthcare services. You don't need very much there, but you need what you need. And what you need needs to be resilient, because you have to give that same experience than people crossing town to go to your normal place. So thinking through those challenges helps kind of drive better outcomes, but it also allows you to optimize and spend the right amount and invest in the right things, but not overspend and not underspend as well.
Great tips, Ed. Thank you. It's been a great conversation. I want to thank all of our viewers as well for tuning in. This is the second in a series of live streams sponsored by Zayo. So continue to tune in and have a great day.
Great. Thanks, Will.